Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Earache with COVID-19 symptoms and treatment. COVID-19 can cause an earache, with effects that include ear pain, hearing loss, or dizziness. Symptoms of an ear infection with the virus that causes COVID can be similar to those of an ear infection caused by other viruses and bacteria. /R/N/R/N long COVID can cause ear symptoms as well. Hearing loss and a ringing in the ears may show up after the infection has resolved. You could still get long COVID symptoms affecting your ear even if you didn't have any other symptoms of COVID-19. /R/N/R/N illustration by Jessica Ola for Very Well Health /R/N/R/N respiratory symptoms, like cough and labored breathing, may be the best known symptoms of COVID, but they are not the only ones. Ear pain, otalgia, may occur around the ear or in the ear canal. In addition to earache, COVID can cause other ear symptoms such as /R/N/R/N SARS-CoV-2. The virus that causes COVID can cause ear infections. It can infect the inner ear as well as the middle ear. The inner ear is responsible for your sense of balance and hearing. Viral infections of the inner ear can cause balance and hearing problems in some people with COVID. /R/N/R/N when the virus infects the middle ear, it can cause otitis media with effusion. This condition occurs when fluid builds up in the middle ear, creating an ideal environment for viruses or bacteria to multiply. With a middle ear infection, you may experience /R/N/R/N hearing and/or balance problems appear to occur equally regardless of the variant of the virus you get infected with. In a 2022 study, the Alpha/Beta, Delta, and Omicron variants of SARS-CoV-2 were equally likely to cause ear problems like fullness, hearing loss, tinnitus, and dizziness. /R/N/R/N risk factors for an earache with COVID can include smoking, year-round or seasonal allergies, and a cold or respiratory infection. Earache can occur more often in children because of their smaller eustachian tubes, but many of these symptoms overlap. If you or your child are experiencing symptoms that you think could be either COVID or an ear infection, see your healthcare provider for diagnosis. /R/N/R/N long COVID refers to any medical condition that lasts for 4 weeks or more after the initial SARS-CoV-2 infection has resolved. The following ear symptoms may be a sign of long COVID. /R/N/R/N post-acute symptoms may last for 3 to 12 weeks, while chronic symptoms can last 12 weeks or more. COVID tests won't likely show that you have COVID even though you may still be having long-lasting symptoms related to the virus. /R/N/R/N ear problems aren't the typical symptoms you would expect if you think you have COVID. More commonly, you may have one or more of the following symptoms: /R/N/R/N SARS-CoV-2 is not the only infectious agent that can cause an ear infection. Other viruses and bacteria can infect the ear as well. The illness may start out as a seemingly benign cold or a respiratory infection. /R/N/R/N while ear infections are more common in children, adults can get them too. A cold or allergy can cause inflammation and swelling of the eustachian tube. When this happens, fluid builds up behind the eardrum. Viruses and bacteria can multiply in this fluid, causing an infection of the middle ear. /R/N/R/N ear pain can be caused by more conditions than an ear infection, including those listed below. /R/N/R/N given how variable both COVID-19 and ear infections can be, you shouldn't try to self-diagnose. Both COVID-19 and an ear infection can cause similar symptoms like fever and headaches. /R/N/R/N if you think you have COVID or an ear infection, see a healthcare provider or an ear, nose, and throat (ENT) specialist for. /R/N/R/N see a healthcare provider if you have chronic, recurrent, ear infections, fluid that refuses to drain away, or symptoms that aren't improving after 2 or 3 days. Get immediate medical treatment if you or someone else has these serious signs of COVID-19. /r/n/r/n Sign up for our Health Tip of the Day newsletter, and receive daily tips that will help you live your healthiest life. /r/n/r/n Thank you. Form.email, for signing up. /r/n/r/n There was an error. Please try again. /r/n/r/n COVID ear symptoms may go away on their own as your body works on getting rid of the virus. Long COVID, however, can cause symptoms to last for weeks, months, or even years after you recover. /r/n/r/n See a healthcare provider or ENT specialist to get specific treatment for your ear symptoms. They can include /r/n/r/n decongestants, antihistamines, or nasal steroids may be in order to help clear blockage. Pain medication can be used to alleviate discomfort. /r/n/r/n Chronic ear infections that recur often or that present consistent fluid buildup in the middle ear may require treatment with ear tubes, which are small cylinders that are positioned through the eardrum to allow easy passage of air into the middle ear. They are inserted during an outpatient surgical procedure known as a myringotomy. /r/n/r/n COVID-19 can lead to ear infections, causing symptoms like hearing loss, ringing in the ears, and fullness. It can also cause ear pain and dizziness. Sometimes ear symptoms go away on their own. In other cases, they may linger as a result of long COVID. /r/n/r/n If you find yourself experiencing symptoms of either COVID-19 or an ear infection, consult your healthcare provider right away. It is important that you be tested for COVID-19 to prevent the spread of the virus. /r/n/r/n An ear infection that doesn't go away on its own and is left untreated can result in pain and hearing problems. If your symptoms become more extreme, seek medical attention right away. /r/n/r/n The information in this article is current as of the date listed, which means newer information may be available when you read this. For the most recent updates on COVID-19, visit our coronavirus news page. /r/n/r/n Sign up for our Health Tip of the Day newsletter, and receive daily tips that will help you live your healthiest life. /r/n/r/n Thank you. Form.email, for signing up. /r/n/r/n There was an error. Please try again. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.